Tonight is all about male menopause. And does it happen to all males? And is it related to erectile dysfunction?
On behalf of all the desperate men out there who are fearful that, hey, obviously I don't want to lose 1 to 2% of my testosterone every year after I'm 40, how do I stop it from going down so fast?
Also, the story of a man whose low testosterone levels drove him into depression.
I felt like a zombie. There was no drive at all. I even had these suicidal thoughts.
Find out what exactly happened to him right here on Let's Talk About Health.
Hey guys, welcome to the program. Great to have you with us tonight.
So Mike, all women will have to deal with menopause eventually.
Yeah.
I'm sure we all know this by now. But do you believe that men will also go through male menopause?
Well, you know, I do know that there is male menopause and it's called andropause, but what I don't know is if it's something that all men will have to go through or if it's just a condition that affects, you know, certain guys.
Yeah, I'm sure you think about that sometimes too. But loads of questions. I mean, we have tons more from our guests this evening as well. Please welcome Joshua Tan, Sivakumar, and Dr. Colin Teo.
Come on out,
Welcome,
guys.
guys. Come on out.
Yes.
Doing that runway walk.
We're fit, we're fit.
Yeah.
We still got it, okay?
Yep.
Nothing to prove.
You know, Joshua, the more you say that, the more nervous energy I'm getting from you. So what do you know about male menopause?
I have to be honest, I never knew anything about it. I've never heard of it.
The first time I heard it was actually my mom. She was half joking to my dad, like, hey, you sure you don't have andropause? And my dad and I were like, what on earth is andropause? So I had to Google it. I was like, oh, Dad, you should go get yourself checked out.
It's a thing.
Yeah, it's an actual thing.
That's
Yeah.
bizarre. So, Doctor, tell us about it.
Right, so andropause is popular because, well, it combines andrology, which is a study of male, and then pause pretty much just came from menopause.
What is the main difference between andropause and menopause? Because a lot of us were always like, oh, you're in a bad mood, or must be menopause, right? Like people throw around these terms so loosely.
Now you can throw it back at us.
Yeah, exactly. It must be andropause.
Right, so there are similarities, that's why they are matched, but there are differences. First of all, both involve the drop in the so-called gender or sex-specific hormones that we tend to have more. Men tend to have more testosterone, so when that starts dropping in terms of production, you go into andropause. For ladies, it's basically pretty much the estrogen that drops. The difference between male and female is that ladies have regular menstrual cycle and period, so when menopause comes, you just stop bleeding.
Yeah.
For men, there's no difference. So it's hard to tell for men. Erectile dysfunction is one of the effects of andropause. You can start to put on weight, your body muscle mass starts to drop, you start getting irritable, you lose your drive, and we're not talking about just sex drive, but drive at work. We don't diagnose it just by listening to symptoms, because if you say you're irritable, it could be because you just had a bad night or your boss is not happy, you didn't get a pay rise. You need then to confirm it with a blood test to actually measure the testosterone level in a male, and when that is low at a certain level, then you got your diagnosis.
Right, so you would say the main cause of andropause would be, I mean, it's age-related firstly. Secondly, the drop in testosterone.
Right, what we know is from 40 years onwards, the testosterone production drops about 1 to 2% per year. There are some guys who never ever drops the level, but a certain proportion of guys would have that.
I need to ask you a
Please,
desperate question.
I feel
I'm
like,
so desperate.
You know what? I've been seeing Joshua like this.
I just can't wait. Sorry, please, let me.
Okay.
On behalf of all the desperate men out there who are fearful that, hey, obviously I don't want to lose 1 to 2% of my testosterone every year after I'm 40, how do I increase or protect, at least stop it from going down so fast?
So very good point. Well, healthy lifestyle really makes a difference. Let's say you're overweight, and if you don't have enough sleep, less than 5 hours, you have a high stress levels, testosterone tend to drop. So having a healthy lifestyle, eating healthily, certain foods are high in estrogen, some foods maybe...
Wait, on that note, I know some friends who are like, oh, I don't want to drink soybean or eat tau hui because... Is it true?
Lambic, right?
Wait, is it true or is it a myth? I must know as well.
You can actually add one more to that is mint.
Oh,
Mint?
yes,
Yeah.
you're right, mint.
Is
yes.
mint a thing? I didn't
I've
know
heard of that.
So apparently, like, the myth is that if you have too much mint,
Yeah.
it lowers your sperm count.
No way.
Spearmint?
There's some suggestion that actually there are foods which have phytoestrogens.
Okay.
So it's more like there are more estrogenic compound in them as opposed to it's gonna knock off your testosterone. I mean, I've taken Min all my life. I've got 4 kids, so I'm not exactly.
I need to clap for you right there. This man here has 4 kids.
This Dr. Bole.
Yeah, man.
So tell us about this ADAM test.
Yeah.
ADAM actually stands for androgen deficiency in aging male. It is a questionnaire of 10 questions. As long as there's a positive response, like yes or no, to either 3 out of the 10 questions, then we can't diagnose you as having testosterone deficiency, but you probably then would think that maybe you want to do a blood level of your testosterone. I've seen patients who are like marathon runners. They're lean and fit looking, but when you check their levels, it's really low.
Oh,
so
That's
sometimes
what I
you
heard.
can't-
Marathon
yeah.
runners, their testosterone can drop, right?
Well, anytime you overtrain for any kind of training, you can drop your immunity, your body becomes unhealthy. So that you got to balance things out.
So like bodybuilders and all?
Yeah, doctor, I was going to say, like, in poly, right, a lot of us were into gymming, like, really
Yes.
hard, because everyone wants to get buff,
Yeah.
get
Yeah,
big.
yeah,
We were all quite skinny back then. Some of the guys were having supplements. Does it mean that steroid and supplement use can actually affect your testosterone negatively?
Oh, yes. If you had no problem, but you're loading yourself with testosterone, your testes will actually shrink.
Right.
That's what I heard. Because there's this rumor,
Joshua very
okay?
passionate about this. I'm not sure
really,
if
really,
you've
really.
heard
You seem to be gossiping a lot. Right?
No, I'm not gossiping. I'm just passing on the message to my fellow worried men.
Okay.
So there's always this rumor like, oh, you know, bodybuilders who use roids always have tiny peckers or,
Yeah.
for lack of a better word, like doctor said,
But it's for
small
testicles,
testes.
really.
Yeah.
Right, because when the body notices that there is high testosterone levels in the blood, the factory says, okay, let's not produce too much, let's close shop. So what happens is the testes get smaller, and if you're talking about fertility, you can get a 0 sperm count, literally.
What?
Zero.
Wow.
Right, right.
Well, there is way too much to talk about here.
Yeah.
When we come back, we'll get to more of it. We talked about testosterone deficiency syndrome, also known as TDS. We'll get to that.
And we'll also share the story of a man diagnosed with TDS, cost him his health, his job, and his marriage. Find out what happened right after the break. Love this.
Welcome back to Let's Talk About Health. We've been talking about Andropause.
We've got a story of a man diagnosed with TDS, and his condition cost him his health, his job, and his marriage. So find out how he turned his life around. Let's take a look.
Back in November 2019, 47-year-old John woke up one morning to find his life suddenly taken over by the toilet.
I remember I went to the toilet for about 20 times in just 1 hour. There was this strong urge to want to pee, but every time I go to the toilet, right, there was only just a few drops or there wasn't any pee at all. It affected my sleep and I couldn't work, and eventually it took over my entire life. At first I thought it was UTI. So I went to the GP, I told him my condition. The GP gave me antibiotics. I took the antibiotics for about 4 days. It was not useful at all. My condition got from bad to worse. Besides having the urge to pee, right, there was this excruciating pain at my groin area, and there was this numbness at my thigh area as well. And the only time where I could find myself relief is when I was sleeping in deep sleep.
In desperation, John sought treatment from a few urologists before he was finally diagnosed with both chronic prostatitis and BPH.
Prostatitis is a gland that is dependent on testosterone in terms of the prostate. So we find that patients with chronic prostatitis being a chronic condition, there is an associated low testosterone. And there's actually a blood test that can measure the testosterone and tell us is it low or not.
The doctor actually recommended me to do shockwave therapy, which I went for about 10 times just to ease my pain. I was given a bunch of medications and also made to go through a series of blood tests.
And the blood tests revealed that John was suffering from yet another condition.
We checked his testosterone level, it was very, very low. He definitely has testosterone deficiency, or what we call andropause, which is like saying female menopause. As the levels drop, at different levels, you see different symptoms coming on.
I felt like a zombie. It was not just about having no sex drive. There was no drive at all, and my energy was very low. I just feel like sleeping every day. It affected my work so much that I don't have mood to work, and I eventually resigned from my job. The constant pain and the low testosterone level actually put me in a very bad mental state. I had depression then. I even had these suicidal thoughts. And it didn't really help during then because my marriage was breaking down.
John was then put on TRT, or testosterone replacement therapy.
In John's case, I gave him medicine to try to get his body to produce more testosterone. Under the right guidance, you can actually establish good levels so that you get your life back again.
Within 1 month, my energy level increased. My mental health also improved. The doctor also recommended me to see the psychiatrist to help me with my depression.
Testosterone deficiency pretty much is a lifelong therapy. Unless they correct it and testosterone levels are back, then technically they're cured. For John, his depression, his lack of energy, lack of will to fight, I would say he doesn't have to stop his testosterone replacement, because the moment he stop it, they do feel all the symptoms coming back.
I'm glad I passed the dark time in my life. To be honest, I am not too sure whether my chronic prostatitis will be cured eventually. But with TRT and boosting of my testosterone level, I have one thing less to worry about right now.
You know, John is incredibly brave for sharing his story. And we saw, Doctor, that you prescribed, some medication. How are these medications administered? Are they just oral medications, injections? What are they?
So testosterone itself, treatment can be by oral tablets replacement. You can apply gel on your body every day, or injections. Tablets pretty much have disappeared from the market because tell a guy to take a tablet twice a day, it's not going to be that compliant.
Yeah.
Then something that is easier to apply happens. So the gel is pretty good, but in our weather, and again, telling guys to apply things on themselves daily.
Applying gel.
That's a very girl thing.
If I went in the bathroom and I saw Siva applying gel to his stomach.
Right. So,
Why would you be in the bathroom with me? And why would you?
No, like the work bathroom.
Right.
But then, what happens when you go on TRT?
So when you go on TRT, the testosterone level, you aim to bring it up back to normal level. So you're not abusing, you're not like going to be a Superman, Arnold Schwarzenegger. You want to bring it to the normal levels. Then you observe for the symptoms of TDS disappearing. And amazingly, a lot of these patients are like high-speed career people. Those that require very, I would say, high AQ, aggressive kind of killer
very
instinct kind of
alpha,
job.
yeah.
Right, so any drop in performance, they will feel it. And they come back and they say that, Doc, I'm back. My staff now like me. They thought I got a new girlfriend because I'm so cool now and I'm a great boss. And some would say that my sleep is so not much better. And then their lifestyle comes back. And from a depression study point, depression tends to actually improve severe, becomes just mild impression, or the mild just goes off.
So then, does everybody need this replacement therapy, or are there certain levels of testosterone where you're below a certain threshold, you say, okay, we need to put you on?
The guidelines, there are a few reference levels, but like in the Society for Men's Health in Singapore, we define it as 12 nanomoles per liter, anything below that, but there must be symptoms that come along.
Okay.
And when you replace, you're not really trying to chase a number. You want to look at the symptoms and then improving over time.
Are there any side effects?
There are minimal side effects, but what can happen is some patients, because it's such a powerful hormone, you realize that actually it affects bone growth, but also blood production. So about 15% or so, the blood count goes up. When it goes too high, there's a theoretical risk. We've not seen it happen. Theoretical risk that, your blood is too thick, it may choke up and give you problems with blood clots.
Okay.
I'll tell them that, the simplest thing you can do is now you're producing so much blood. Be a blood donor. Be a blood donor.
Good idea.
Everyone's happy.
Very good.
So they come in. I got a patient recently showing me, I'm now a donor card. Otherwise, then sometimes, let's say the commonest treatment is giving a 3-monthly injection. So instead of that, then sometimes we flip them to the gel. And as on everything else, as long as you're keeping to the right levels, you shouldn't see much of an issue. And testosterone replacement, or TRT, is not just given by urologists. A lot more doctors are actually a lot more comfortable giving this treatment.
No, I'm glad that we're doing this, you know, that we're talking about this and really helping our bros out watching right now. We have to go for a break, but when we return, we're going to ask Joshua, Siva, and Mike actually as well, a very important question. Are you man enough? We'll find out in a bit. We'll see you shortly. Welcome back, and it's time for Ask the Doctor with our roving host, Avery. Let's have a look.
Hi guys, it's Avery, and I'm your go-to guy when any man or women on the streets have got questions about health. And today, I'm joined with an expert, Dr. Tan, who is an expert on men's health, and we're going on the streets to find out if anybody has questions for Dr. Tan.
What can we do to prevent male menopause?
Keep in shape, prevent chronic diseases, don't smoke, and that's your best chance of preventing testosterone deficiency.
How many men actually suffer from this andropause?
Andropause happens more in older men, right? So it can happen to men as young as in their 40s, but men in their 50s and 60s, as many as 1 in 3 will suffer from what we actually like to refer to as testosterone deficiency syndrome rather than andropause. Doctors don't really like this term andropause.
Why is that so? Why don't they like that term, andropause?
For example, all women will suffer from menopause, but not all men will suffer from andropause. There's certain risk factors. Second, menopause is associated with a loss of fertility, right? But men who suffer from testosterone deficiency actually still can be fertile. The third important difference is menopause happens quite suddenly. So usually from normal periods to no periods, it takes about a year. But for men, the drop in testosterone can happen over many years, so it kind of creeps up on you.
I kind of roughly know that testosterone will go down after a certain age. But for andropause itself, how much will it actually affect your testosterone?
There's a lot of inter-individual variability between patients. So some, it will drop faster, they'll get symptoms. Actually, some guys, they won't even drop at all. I have patients well into their 70s with still a normal level of testosterone. Guys who are slightly older, who go into their 40s, doctors will also recommend that they do more strength-building exercises. So there's always this question about, should I run more marathons or should I spend more time in the gym? Actually, to build testosterone, spending more time in the gym and building nice muscles really help with natural testosterone production.
Thank you so much for being here with us today, Dr. Tan. You've answered so many questions, and I feel like I know so much more about andropause or testosterone deficiency.
Thank you for having me.
Well, it's back to the studio.
And now it's time to tackle some myths and misconceptions about testosterone and andropause with Joshua, Siva, and Mike. This is not a competition.
Yeah, right.
But the quiz is called Are You Man Enough? And just like that, it's a competition.
Yeah.
Okay.
Yeah. All right.
All right, if you get the answer right, you'll stick a post-it on yourself, okay? Doctor's gonna help me verify whether the questions are answered right or not. Let's go. Question 1. Being bald is a sign of having higher testosterone. True or false?
Come on, Mike.
Okay, doctor, let's reveal it.
False is the right answer.
Oh.
Man up, guys.
All right, he's on, man. Okay, doctor, can you explain?
Male pattern baldness doesn't depend on whether you need to have high testosterone or not. So if you're bald, but you can still be having TDS, so that itself doesn't mean that you are well. If you have testosterone deficiency syndrome symptoms, then you should still go and have a check. Right.
Okay.
Next question, okay. Testosterone is a sex hormone. True or false?
Is there a time limit or?
In a way, it's a bit of a trick question. We usually think that it's a sex hormone, but because testosterone for a male affects almost every organ in your male body, so it's more than a sex hormone. We call it a metabolic hormone.
Oh, do you know why, guys? Because I'm with...
Man enough, is it? Okay, you're man enough.
All right, what's the next question? Let's go. I want to catch up.
Mike is on. Okay.
Yeah.
Which one of these may lower your testosterone? You see in front of you right now. Take a look. We've got tofu or bananas.
So this is a trick question because bananas, you would think
Is it because of how it looks?
Because it's full of vitamin D.
All right.
Yeah.
Okay.
We're all going bananas?
I'll
all
change
going
then.
bananas.
I'll change then.
Okay, there was some mention that actually certain foods have phytoestrogens. That means there's some estrogen levels in the food. So tofu, soy, pretty much would have a higher level of estrogen.
Okay.
Banana is just pretty good as a fruit. So I would say that tofu would be the right.
He actually picked up the banana, then he said, oh, then I will pick.
Doctor, thank you. We will settle payment later, okay?
There's been something going on.
Guys, we just talked about soy products earlier.
No, I think they thought it's a trick question.
No, because you kept saying it. It's a trick question. It's a trick question.
Okay, next question. Which one of these vitamins may help boost testosterone? Now, you've got 2 shot glasses in front of you that contain vitamins. One is vitamin C, one is vitamin D.
Oh, C and D?
Okay.
Which one of these?
Simply because the alphabet, I'm going to choose vitamin D because we always need more.
Okay, to boost testosterone.
Okay, I'm going to
energy.
assume that you must at some point here get one wrong. And so I'm going to bet against you here. I'm going with C.
Okay, so you are going with
C.
C, and you're going with D.
Because I believe he has to get at least one
Okay,
wrong.
the last time I was with you.
I'm going to join my team, Siva. Join
all
my
right,
team.
cheers.
Cheers,
I'm
mate.
going to try it this time.
Okay, all right. I'm curious to know, doctor, please, drum roll.
Right, anything to do with getting into the sun would boost your testosterone. So vitamin D is the answer.
Oh my
Yes! I finally get it posted.
Mike, you're at 0.
I feel
dude.
like I'm
what's
literally
happening?
shrinking.
He's losing testosterone as
One
he's
for you, Mike. One for you, Mike.
Okay, last question. Even though this is not going to help Mike at all, but here we go. We're going to try. Which of these activities raises testosterone? Skipping or weightlifting?
Okay, this one I'm...
This one I know.
Yep.
Yeah, confirm. Because doctor said, right, the more weight you have, right, the less testosterone you have. But
So right now, you can see the testosterone building in my arm.
You're literally turning red right now, Mike.
all right, okay.
No,
Yeah, skipping.
Yep.
Doctor's like heavily judging us right now.
Set the record straight.
Please
Come on,
tell
Doc.
us.
Yeah.
Actually, high intensity muscle building would raise testosterone a lot more than cardio exercises.
So
in
Mike
this
is
case, I think Mike has the upper hand.
Yes!
This is a consolation prize, by the
Okay,
way.
Mike, you know what? You deserve
I'd like
it.
to thank all of the people who stuck by me for the first 4 questions.
Literally no one
Oh,
stuck
I
by
did, Mike.
him.
Oh, by the way.
It didn't work out for Siva very well. Okay, to
Yeah.
conclude this segment, who is man enough?
Oh.
Joshua!
Joshua wins. The young lad, the young
Yep,
chap.
yep.
This was a very revealing game. I really enjoyed it. This was so much fun for me. And we learned a lot as well about CDS and so much more.
That's right, testosterone deficiency syndrome. A huge thanks to Dr. Teo. Appreciate you so much for coming on and explaining all of this. And our guest, King Joshua.
Oh, thank you.
And Siva, of course, for joining us. We'll see you guys next time on
Let's talk about health.
Hey guys, if you enjoyed this episode, make sure to check out We Need to Talk About This on our digital platforms.
Any other indicators of what an abnormal period?
It is also a problem if you're like passing clots. If you're passing clot bigger than 2.5 centimeters or size of a $1 coin, it's indicating that you're actually bleeding quite heavily and your body's natural mechanism is to clot to prevent heavy bleeding.